Good evening, everyone, and welcome to Nurse Practitioner Week and to Frontier Nursing University's celebration of Nurse Practitioner Week. Tonight is our first session for the week, and we'll be presenting students and their journey through distance education. So welcome. The title of our session is Becoming a Nurse Practitioner, A Journey in Distance Education. Dr. Paula Delpech and I are the co-host. Dr. Delpech, would you take just a minute to introduce yourself? I can introduce Dr. Delpech. Dr. Delpech is faculty in the Psych-Mental Health Nurse Practitioner program, and I'm the chair for the Department of Family Nursing. And we have 4 student panelists with us tonight who are going to share their experiences of graduate education and distance education at Frontier. And students, would you mind introducing yourselves, starting with Haley, if you'll give us your name and where you live and what program you're in.
Hi, my name is Haley. I'm calling in from Seattle, Washington. I just graduated back in July with my Women's Health Nurse Practitioner degree. So now I'm a practicing WHNP since about August, so still a very new provider. I immediately started back and am working on my doctorate, so now I'm currently in the DNP program.
Thank you, Haley. And Timothy. Tim, would you go next?
Yes. Hi, everybody. My name's Tim Black, and I'm coming to you from Mount Airy, North Carolina. I am I'm a senior in the FNP program, and I am hopefully roughly, I guess, a couple months from graduating. So I'm on I think the short end of the program.
Thank you, Tim. Michelle?
Hi, everyone. My name is Michelle Morgan. I'm in Lynchburg, Virginia, and I just finished the Psych Mental Health Master's program in September and just passed my boards. And I also just applied for DNP, so we'll hopefully be enrolled again soon.
Congratulations on that certification.
Congratulations, Michelle.
And Genevieve.
Hi, I'm from Minneapolis, Minnesota, and I am a family nurse practitioner, a graduate of Frontier. And immediately after graduating with my family nurse practitioner degree, I went right back for my postmaster's psychiatric-mental health nurse practitioner certification. And I'm in my last term of that, my last few weeks of it, actually.
So, welcome to our panelists and welcome to those of you who are attending. Just a reminder of Frontier's mission. This mission is truly something that guides us through course development and the curriculum, and it's a living, breathing organism to us. And I'm just going to read it to you. Our mission is to provide accessible nurse midwifery and nurse practitioner education to prepare competent, entrepreneurial, ethical, and compassionate leaders in primary care to serve all individuals with emphasis on women and families in diverse, rural, and underserved populations. And just a brief explanation of our programs. We have an MSN and a postgraduate certificate in 4 specialty tracks: nurse midwifery, the family nurse practitioner, women's healthcare nurse practitioner, and the psych mental health nurse practitioner. We also offer a doctorate in nursing practice with 2 pathways: the companion DNP, which is joined with MSN entry, and then a postmaster's DNP for students who already have an MSN. The focus of our time tonight is really on the students who are serving on the panel. So we have a series of questions that we're going to ask them that kind of help explain their experiences and what they found beneficial and what advice they have for those of you who are thinking about graduate education or may be new to the program. The first question is, and I'd like for each of our panel members to answer this. Can you tell us which programs you're in and where you are in the program? Well, I believe y'all have already answered this question, haven't you, in your introduction? So we'll move on to the next question. Dr. Delpech?
Great. So question number 2. What is one piece of advice for someone considering becoming an NP student and for someone who is currently a student?
I can go ahead and start. One piece of advice I would say for someone who is considering becoming an NP student and joining Frontier would be to really trust that instinct and that call that getting an advanced practice degree is kind of your mission or your goal. I was not a nurse for a very long time before starting the program. I worked labor and delivery and then fertility for about 3.5 years when I applied for the program. So I was still a fairly new nurse, but I think I started to already start to think that I could do more and that I really wanted to look more into the diagnosis and actually having that more independent role. But I was really scared. I really was nervous. I felt like I hadn't been a nurse long enough. I was in a very specialty women's health area that I still am in and still love, but it was kind of a leap of faith. And so I think my advice would be to really trust that desire and know that, you know, once you start, you'll start to come in your own and you're not just expected to already to know all the answers. So just to follow that calling. And I had kind of a realization actually just this last weekend. One of my best friends is in the FMP program at Frontier. So we're both big Frontier fans. And she's in the middle of her clinicals right now. And I was kind of giving her that advice of, keep going, you can do it, it'll be worth it. And I was like, wow, I was just there. And now I'm the one giving her that advice. And then when I hear people that have finished their DNP, they tell me the same things. And it's like, oh, well, it's so easy for you to say you're already done. And so I think the big thing is just to know that there are so many students before you who have worked hard and have finished and have done well, and that pretty soon you can be on the other side. So that would be my advice, to just stay strong.
I think that advice I would give new prospective students is to plan, to involve your family in your plan. I think going through a program like this requires a lot more support than you might expect. It is it's a doable task, but it definitely takes a lot of planning and organizing to fulfill your dream of completing a program. It requires commitment, attention to detail, and a degree of organization that I had to develop as I was going through the program that I didn't have prior to. I definitely think it enhanced that. Actually, it probably developed that organization plan for me as I was going through the program. And as I come to the end of the program, I think that not only will I finish with an FNP, but I will finish with a degree of organization that will help me guide me through other aspects of my life that I didn't have prior to entering the program.
And I'll just piggyback off of what Haley and Tim said. I do feel like it's definitely a lot about like having confidence in yourself that you can actually do this. I know for me, like having any like difficult moments, just like in nursing school, it's like just trying to remember why I'm doing this. What's my reason for wanting to be a nurse back then, wanting to be a nurse practitioner now. And yeah, just believing that you can achieve this, that there have been a lot of people who've done this before. There's lots of people you can lean on. And also, I would say organization was probably one of the biggest things for me. I thought I was pretty organized before I started the program, but after the first few terms, I had to like whip myself into shape and really get like a giant calendar and have alerts on my phone and really stay on top of things. And that helped me a lot.
And being sort of on the other end of Haley's experience, I'd been out of school for a really long time. I had been out of school for 10 years when I decided to come back. And I was very nervous that, that education wasn't fresh in my mind, and what was it going to be like? And am I going to be the oldest person in my class? And I wasn't, but it was close. And yeah, so there was that intimidation, like, what is it like being so far away from my previous education? And it was not a problem. You start at the beginning. And you're not expected to come with this wealth of knowledge. You're expected to come ready to learn. And I would also say, be prepared to grow throughout the program. And there are definite growing pains, but you will grow and mature into the role of a nurse practitioner, which is not easy, but so worth it. You come out of it very changed as a professional and as a person. And that can be fun, and it can be not so fun. And you do need your family. You need their support. You need everyone around you's support, and get study buddies. Find people in your class, connect with them. They make it very easy to do at Frontier, and I wouldn't have made it through without my study buddies.
So, Dr. Chappell, can I summarize?
Of course you can.
So I think sometimes as students, we tend to think that faculty have it all, but I think I just listened to some pearls of wisdom that I think is also applicable to me. And so I would just like to recap on some of the things for the students that are listening. And so a student mentioned taking a leap of faith. That is so vital when you're getting ready to embark upon this journey, to know that you're taking a leap of faith. Two students mentioned not to expect that you'll have all of the answers. So often I see students come in and they're thinking, oh my gosh, I should know this. You don't have to have all the answers. That's why, we are called professors. And so we're here to help you through getting those answers, having a plan, involving your family. And the one thing that I like that someone said, to rely on your original desire to becoming a nurse. That was so key, because you have to have that desire, prepare to grow. And I just love, because I always say to my students, find a study buddy, and also find someone that loves, well, now we're doing so many things online and everyone is so far, but I came from a brick and mortar, so I would always say to my students, find someone that loves to cook as your study buddy, So thank you, students, for those pearls of wisdom.
I think another thing I heard, Dr. Delpech, was to have confidence in yourself.
Yes.
To have confidence that you can do this.
Yes. Yes.
Okay, question number 3. What are some lessons from your journey? What do you wish you had known before you started?
I wish I would have maybe had more practice or felt more comfortable with flexibility throughout the program. I'm sure we all talk about it at one point during this webinar, but I was one of the students that was doing clinical amidst the COVID-19 pandemic. And I am very much a type A and a planner. And I can honestly say that, like most of us, I never in a million years thought I would be doing clinicals in a pandemic. And so just learning how to just trust the process and rely on the support that Frontier gave me with the flexibility and the changing. And I'm so excited that it worked out and I was able to pull through using the support of Frontier and my preceptors. But it definitely, I would never say that I would do it again in the same way if I could, but it taught me flexibility that I will probably always carry with me throughout my career.
And the one thing I would say is that I learned the lesson that I came away with is change happens every day, and especially through the COVID crisis. I find that I'm too like a type A sort of rigid person, and I had to sort of give that up One, because I was learning something new that it was not my strong point. And it had been a lot of years since I had really been challenged in something that was not, I didn't know. And I felt that once I got into the F&P program, there was a lot of things that I didn't know. And I wondered, like, how did I even make it so far as a nurse without creating some harm? And when we got a little further into it, the COVID definitely has presented some unique challenges that there are unique challenges, but there are also challenges that I think that Frontier was ready and prepared me for.
So for me, probably the biggest lesson that I learned throughout this whole program was not to be afraid to ask other people for help, whether it be your partner, your family, your professors, your coworkers. It's always something that's hard for me, is to ask for help and to lean on other people. But when you're going through something that's this big of a deal and that's this important that you really have to do well in, then you really have to advocate for yourself. And if you need help, with cleaning, or if you have kids, or if you are falling behind in one of your classes, just to make sure you reach out and let somebody know what's going on so that they can help you, because they can't help you if they don't know that you're in need of any kind of help.
My favorite piece of advice that I told myself was, don't let your schooling get in the way of your education. School is hard, and we push ourselves hard through it. I'm not a type A person, but I even found myself sort of sprinting for the finish line, forgetting sometimes that it was a marathon, also forgetting that my life was happening around me. Your life will happen around you during these years or months that you're in school, and you have to find a way to incorporate school in a way that it is joyful sometimes and pleasant and something that you can sometimes look forward to. That's hard to do. That takes a lot of work, but it's worth doing, and it is possible to do. It doesn't have to be this chore that you're constantly just trying to get through to get to the next thing. Your attitude will totally influence your experience. And if you come in with a good attitude and with the idea that you're going to come away with knowledge that you need, you'll have a good time. Things that I wish I had known before I started. It will happen for you. If you commit and you do this, it absolutely will happen for you. I didn't see anybody fail. I think it just won't happen the way you imagine that it will. So that flexibility that everyone else talked about is key. Even if you're a very flexible person, I thought I was a very flexible person. You have to be just a little more flexible than you thought. And there is compromise. You can have it all. You just can't have it all at once.
Some great advice. Well, this is what I heard. Trust the process. And as you move through the curriculum, trust your curriculum, its structure, the way it's designed. Trust that process. Be flexible. I've always thought as nurses, we were flexible, but sometimes we're not so flexible when it comes to us and what we're doing. Maybe we're flexible toward patients, but not ourselves. Change is inevitable. Tim gave a great example of COVID. COVID changed how we delivered education and how students moved through the program, but we did it. Change is inevitable. Ask for help. Ask for help from faculty, from your peers, from your family. Ask for help. People love to help you. I liked, don't let school get in the way of your education. As a student, your job is to build that body of knowledge that transforms you into an advanced practice nurse. So build that body of knowledge. Your attitude influences your experiences. We should embroider that and put it up on our walls. Attitude influences experience. So very true. And it will happen. It may happen in a different way, but it will happen. Great advice. Very well done.
Yes. I wanted to know from Genevieve, you think I can borrow that phrase? Attitude will influence your experience.
It's all yours.
Thank you. It was so pointed. It speaks to everything everyone said. And so now we are going to go to question number 4. And the question is, who is your support system and how do you care for yourself?
My support system, definitely, I have a big family in the area. I'm really lucky to have a very supportive partner. But other than friends and family, I am so happy that I chose to start this program while working at a clinic that I felt very supported by. I worked alongside great nurses that I worked with on a peer-to-peer level. I worked with great providers, nurse practitioners, physicians, had a very supportive manager. I had a really great system in place where I could work full-time and also do school full-time. And although I actually didn't end up really needing to call in a lot of favors to my work because I really felt like Frontier was so, just the whole model was so supportive with whatever work schedule you had. It always was a nice feeling to know that I had the support of my work. And now I'm actually working there as a nurse practitioner, and they hired me right when I graduated. So it was such a great feeling to feel like my school and my work were on the same page and they were supportive of me. So that was a great support system for me. And then just self-care. I think everyone knows this maybe already, but if you're going to push off everything to get school, then you're probably going to end up being less productive. You need to give yourself study breaks, break up your information, break up your study time, and don't neglect things that are important to you, because this is a long program and you're going to burn out if you do that. So.
I think to answer how do you take care of yourself, I think the pacing yourself is probably the most important thing that I learned. I think someone mentioned, that we like to sprint to the end, and it feels like sometimes we want to rush through it. But I found myself that it was difficult to sprint, even though I wanted to sprint to the end, and I had to make some changes, realign some priorities, some goals I had set for myself in school to be more realistic. I was initially a student that was taking 3 classes through the program, and I originally thought that I could maintain that. I had no reason to think that I couldn't. But as I got into the program, I realized that I had to make some changes to realign some goals as, completing the program. And as it turns out, it's not that big a difference by making those changes there to the time that I will actually finish up the program. And that change allowed me to have a life, which again allowed to self-care. So I could get out on my farm and do some work, or, I had a little extra time to go on a vacation that I desperately needed. And I think that if I had maintained the pace that I was originally started at, I might have burned out and maybe not even been as successful as I am now. As to my support system, I would say my family is the number one support system. They pretty much have sacrificed everything to ensure that I have gotten this far. I guess that's one thing that, looking back on, I'm not sure how I could have done that better, but definitely in the end, I think that they are seeing that light at the end of the tunnel, probably more so than I am. And, that was a blessing of having them. And then I received some unique support from the clinical rotations that I'm doing rotations in. They are very supportive and trying to make sure I have the best experience, and even try to work with my weird schedule that I have, and, cheering me on when, the patient says, I don't want a student today. That's so discouraging at times, and I definitely can understand. But I think, especially in some of my women's health rotations, I've definitely hit a few roadblocks there, but they've been very supportive in trying to get me past those roadblocks and not let me fret about the things I can't control. But, overall, I'm very supported in this endeavor to become an FNP.
So for me, support system is mainly my husband and my parents. They've been with me every step of the way. After every exam, after every presentation, they're checking in, making sure I'm okay, making sure I did okay. So they've been just amazing. And also like Haley, I've had some really great coworkers, and I'm actually going to be starting there as a psych NP in a couple weeks. And it's where I've been working for the past few years. And they were the ones that basically the second I applied to this program, I told them. And so they've been following me the whole way. And my preceptors are also where I work. And it's just been a really nurturing environment. And I'm just excited to keep working with them. And as far as how I take care of myself, just general self-care. I try to do like mindfulness exercises. I have a bunch of apps on mindfulness. I'm a huge proponent of that, and trying to keep anxiety at bay, trying to do some yoga, healthy eating. And for me, I have 5 cats, and they've also been a huge stress reliever. It's amazing how they seem to know, like once I'm getting stressed or if I'm working on something and I need to take a break, they'll just conveniently like lay on my computer or do something where I'm like, okay, I have to get up and I have to do something else. And also I really like doing like arts and crafts. So that's something that was a nice little break from studying or from projects, was just to spend an hour just working on something creative.
My support system, you know, my family, my husband, my kids, who both became adults while I was in this program and took off on their own. But I think that you have to be your support system too. I had to teach people how to support me because it wasn't something that I have ever needed in the past. I am pretty independent and rarely do I need emotional support. And so suddenly I was looking around like, oh, you all think I just have this. I don't. So letting people know how to support you, I think, is a big deal. And that'll be bumpy too, because you're asking people in your family and in your support group to take on these new roles in your life. So just being very honest with them that you'll need that, and talking to them before you begin the program. Is this a commitment that you can make? Can you decide that you guys are cleaning the house from now on? You know, ask people to join you and help you. People like to help. And then taking care of myself, I actually had to schedule my study time the way that I scheduled my job, this hour to this hour. And it was school, and I stuck to it as much as I could. And I tried not to go over when I didn't have to. And I started exercising for the first time in my life, which I now love. And I had that very regimented as well. And I think that I would not have gotten through it without that, which is new for me because I'm not, again, type A, I'm not a hyper organized person. That's part of the organization that started to build for me as I realized that I needed an outlet and a way to make myself feel good. So I think even if you can't identify right now what's going to help me, you'll learn as you go how you need to take care of yourself.
Anybody else wanted to add anything? Any other ideas came up? Wow. Again, you know, I picked up so many things that I wish I knew before I went to school. And so again, ladies and gentlemen, thank you for sharing these ideas. I just love the idea of that Timmy said, do not, and he used this word, do not fret about the things you cannot control. Because we have a tendency to want to fret about things, you know. We went into the program, you know, we are going to take 3 classes a term and it's not going to work out that way. And therefore we are fretting over it and we are building up, you know, this whole level of anxiety that is not warranted. And so I like the idea of, you know, telling students, know that change needs to happen sometimes. You know, your plans may not be the plans that you set out to be. And so know yourself And, you know, everyone talked about family support. Definitely family support is key to this. And knowing when to ask for help. You know, as nurses, we really don't like to ask for help because we can do it all. And a lot of you mentioned type A personality, and I love that Genevieve says that she's not a type A personality. And I've been trying to fight that personality, but I have to tell you, Genevieve, as nurses, you know, we all fall into this category of a type A personality. And I think this is where some of the anxiety comes about. But knowing yourself and knowing your support system, I think it's key to success. So thank you for answering that question, everyone.
I think an important point that Genevieve made too was that as nurses, we're caregivers. We're not used to being the recipient of care, and you have to teach people what you need or let them know what you need when you need it. So, you know, talk to your family and, you know, give them tasks and let them know how they can help you.
And Michelle mentioned something simple as, you know, you may have to ask someone to help you clean the house. You know, don't be afraid. Or, Michelle, I am exercising with a woman on YouTube, and she always says, you know, because she wants us to move the furniture to do exercise. And she said, it's okay to have a messy living room, but it's not okay to be unhealthy. You know, so it's okay to have a messy house until, you know, and say that to your family. You know, you may come over and the house is messy, but you know what, I'm studying. So yeah, be upfront with your family.
Very good. Very nice. Well, I'd like to recognize that Frontier is celebrating the 50th year of the Family Nurse Practitioner Program. So congratulations, Frontier, on the longevity of that program.
Yes.
And just a bit of inspiration for you. Success doesn't come to you, you go to it. So take action, make that application, study for that exam, prepare for certification, go seek your job, you go to it. And then I will bring the slides down so that you can see the participants and invite the audience to ask any questions they may have. You can turn your microphone on, or you can ask your questions in the chat box.
We are so excited to answer your questions, and there aren't dumb questions. It can just be a curiosity. If you are thinking it, somebody else here is also thinking that question, and they just don't want to be the one to raise their hand. But we were in your shoes not that long ago. I had so many questions.
Hi, my name's Julie. I guess I have a question. I'm from Minneapolis, and I'm wondering about how to start, even beginning to choose precepting, how to set all of that stuff up. I'm wondering how you did that.
So as a Minneapolis girl, I will say one of the reasons that I chose Frontier was so that I could sort of cultivate my own specific clinical experience. I knew what specialties I was very interested in. I knew what kind of clinical sites I wanted to get experience in. I had this beautiful, perfect plan, and then that all fell apart. And then I rebuilt this other perfect plan, and then some of it fell apart. So I would say one thing to do is to start the preceptor journey right away. Look around your community. Network like crazy, talk to other Frontier students, talk to your clinical advisors, pull in everyone that you know and everyone that they know, and start identifying preceptors right away. And then be open to that plan changing, because it will probably change. Sometimes people say, you know, well, I have to just start calling around to clinics and asking. Yeah, I did a lot of that. I did a lot of that when a part of my plan fell apart. And I wound up somewhere I never thought I would have wanted to be. And it was one of the best clinical experiences I could have hoped for. But that is a big thing that has changed during COVID, is that not everyone is open for students to come in. There's limited hours, there's limited times. Frontier is aware of that, and they have worked really hard with those of us that have been in clinical to make sure that we are still getting the opportunities that we need. They're bending over backwards to help us out with this, but you have to work as hard. So it is not a passive experience. Finding a good preceptor is an active job. You have to think about it as a job.
I'm chiming in on that. Frontier does have a system called the Community Map, where they do list places that have acted as a preceptor before. They have a whole list of like alumni, where alumni can say that they are wanting to be a preceptor or would be open to it. So I will not, lie that you do need to work really hard and go out of your comfort zone. But like Genevieve, I loved that I got to choose people that were invested in me, that wanted to work with me. I was never randomly assigned with anyone. And it took persistence. I think I emailed Planned Parenthood over and over and over again, but then I heard back and I had a great experience. And so it takes you out of your comfort zone, but it has strengthened just my commitment to the field in general.
I think for me, using a community map was useful to locate clinical rotation sites, and then also finding other Frontier students that had went through the programs or other FNP students, and using following on their coattails and trying to figure out what was good and what was bad as far as where to go for precepting. And I think that the places that I landed, at least two of them, that had a history of having Frontier students, and they were very happy with Frontier students, just for the fact that their students were engaged, on time, and worked very hard to perform inside of the clinical rotation. And then I discovered two new locations that just opened up, and I think that going forward, the students that come after me hopefully will have a successful time there also.
And I started as well with my preceptor search, probably like even before I found out that I was admitted. Started networking and finding people that I felt like I would have a good, working relationship with. And like Haley said as well, I enjoyed the fact that, I think Genevieve said it too, that that you could basically make your own clinical plan. And so it really worked with my life. I don't think I really had to do any clinicals during, weird hours, or it was very nice. That way I could still have plenty of time for schoolwork, plenty of time, well, not plenty of time for life stuff, but still had a little bit of time to do things I wanted to do. But I really did make my own schedule, more or less, for clinicals. But yeah, I would recommend, the sooner the better. Go ahead and start networking, seeing if you can meet people. I actually got some names from some drug reps, and you can find names in the weirdest places. And yeah, the community map seems to be really helpful too.
How many preceptors are we going to need? I mean, for the FNP program?
They like you to have, I think, at least two, but I know people that only had one. It depends, I think, on where you are and what it is that you're looking for. I had a couple of friends that I met in the program who were very rural. I mean, they live in the middle of nowhere, and there was one FNP in the entire area, and that's who they were with. They had a wonderful experience.
And I would add to that, it does depend on the types of patients you see at the site, because in the FNP program, we have visit types that you have to accomplish. Students may have 3 preceptors to get all of those in, but depending on what's offered at a particular site, it may be 2 preceptor sites. So it depends on what types of patients you're able to see in each site.
I wanted to add on that for if there's any psych mental health students. So again, as Dr. Chappell mentioned, it all depends on the patient, the type of patients mix that you have to see. And so in my experience, I had to have 3 different preceptors because I had to, psych mental health is across the lifespan. And so I had to get someone that focused on pediatrics, someone that did adults, and then I also wanted to have a rotation in substance misuse.
Okay, thank you guys so much.
One last piece of advice before we move on, with the number of preceptors, I think it really also, you will find that it will vary from each site to site on what they prefer, because I did find that some places initially committed and then a little further on, they're like, oh, we will do actually, you can have 2 days a week, or you can do, all of a sudden one of them was going to take an intermittent maternity leave. So she was going to do 3 weeks, like she was going to do this kind of unique schedule. So they were very flexible with working with me, but you might just find that different sites will let you be there a certain number of hours. And so it's nice to have a flexible plan where you can kind of have multiple options, not relying on one person's schedule. Because if they were to get sick or all of a sudden change their hours, you want to have options. I think it's nice.
Definitely.
There's a question, can you obtain the MSN while moving forward in the companion DMP program? And I did that while I was getting my MSN. I don't know, you guys that are in the DMP program can probably speak to this better than me, but yes, some of the classes that I took throughout my master's program were additional classes that were built into the program, so that I've completed some of my doctorate classes while getting my MSN.
Yeah, I did the companion DMP. So based off of my track, it will be about 3 years. I did the full-time track and I was doing some of the doctorate classes while then finishing my master's. So it was pretty seamless, like it's pretty straightforward, straight through.
Students, can I draw your attention to a couple of other questions? Matt asked, the clinical site assistant for out-of-state students.
I'd say community map would be really helpful for that.
If you mean out of state from Kentucky, so when you're getting close to your clinical experience, you're assigned somebody who's called your regional clinical faculty. And they are faculty that help you with your entire clinical experience, and it's regional, it's based on where you live. They can help you with ideas for where to find preceptors. Some of them even, I know, have precepted students that had things like last minute, their clinical fell through and now they're precepting with their regional clinical faculty. So yes, it doesn't really matter what state you're in. It's all sort of out of state placement.
Somebody asked, what's the job market for WHMPs?
I can speak to that. I get that question a lot, actually. And I did think about doing FMP originally, but I love women's health. I identified that early on in nursing school. I worked labor and delivery, and then I still work in a fertility clinic. And I more felt that it really was my calling, and I wanted to go into clinicals and a future job really feeling like an expert. I didn't want to, although I knew that if I got maybe like an FMP degree, I could still work in women's health. I really wanted to go into it feeling like an expert in the field and that I had a very specialized track. And for me, I haven't really regretted it. Just going in feeling like I had 2 years of very specialized knowledge, and it made clinical and my boards exam just feel really like I got all the information that I really wanted to know. And of course I'm still learning, but it made my job search a little bit more narrow. So I was looking at OBGYN clinics, fertility clinics, sexual health clinics, because women's health, the scope has now been extended to men for reproductive health and sexual health. And so those are really your job options. If you're choosing the WHMP, you're kind of committing yourself into a more specialized field. So I get that that's not the route everyone wants to go. But my draw was that I just wanted to go into my future field feeling fully prepared.
Another question is, can you get a job as F&P if you continue on to the DMP, or do you only take the boards at the end of the full program?
Yes, you finish your MSN and then you take your boards, and then you can continue on in your doctorate.
Thank you. Where do I find the community map?
You have to be a student to find the community map. It's special and secret just for us Frontier students.
Were you able to sit for boards to get the MSN and be a part of the companion program?
Yes, similar to the previous question. Yes, you can finish the program in stages. So you finish your master's degree, and even if you are taking some classes that are a part of the companion DMP, you still finish with your master's. You can sit for your boards, and then you just continue.
Good, very good. Okay, here's a long question. Hello, everyone. I'm just getting on. I'm sure I missed a lot. I'm currently practicing as a perinatal nurse and med-surg peds. I'm interested in the F&P, but I'm curious about women's health. I also want to get the DMP. I currently hold an MSN. I'm in California. I work full-time. Is online doable through Frontier?
Yes, yes, it is. And if you're anything like me, why stop at one specialty? Just keep Frontier forever and get all the specialties. It's very doable, created to be doable. Frontier has been doing online school before online school really exploded. They have excellent programs. It is tailored for distance learning, and you can really, really tell. I felt supported the entire time I was in school. I never felt like I wasn't connected with the program that I was in. And it was set up so that I could work full time and raise my family and have my life.
I would definitely say it's very doable as well. I did psych instead of F&P, but I feel like most people across all the programs worked full time, probably the majority. And yeah, it's definitely doable. Like Genevieve said, this program was built for this. It's Frontier knows what they're doing. They've been doing this for a long time, and they know how to make this work with your life and your current schedule.
Okay, to the panel, to the members of the panel, do you have any closing remarks that you'd like to share?
Actually, Lisa, I don't mean to interrupt, but we do have 2 more questions that came.
Oh, thank you so much.
Yeah, the first one from Veronica, it is, what would the timeline for completion be?
For Veronica, I can answer that question. For the MSN, it's 5 years. For the MSN plus a companion is 7 years. Thank you, Tiara.
And sorry, go ahead.
How is the clinical bound experience working amid the COVID? I don't think any of the panelists here have gone through clinical bound since COVID, have you?
I have.
Yeah, Tim and
Tell us about it.
I will say that was a bittersweet experience. Bitter because I wanted to see come back on campus, and I was looking forward to that little escape. I felt like it was at least it was like summer camp in a sort of a way. So I was waiting for my summer camp experience, and I was disheartened that that was not going to occur. But I will say that I think what Frontier did with Clinical Bound was incredible. Part of it is that I was in class with students that went and checked into hotels. Some went to unique places that made it unique to them, but we were all in class together all day long. And it's funny, it's sort of like watching a subtitle on a movie. You first start reading the words and you start thinking about what they're saying, and then suddenly you're living the experience and you're no longer reading the words anymore, and you're understanding the language, and how the brain takes over and does its thing. So I felt Clinical Bound was sort of like that. And it was amazing that it was almost, I won't say it was better because I don't have that experience to say it was better, but I would think it'd be hard pressed to make it on-campus experience better than what I experienced in the online component of the virtual Clinical Bound.
And I've done both. I did, because this is my second master's at Frontier. I've done them in person and I did them just recently online. And I was so disappointed for summer camp. I was going to go back. And I was very excited to see all my buddies I had met from previously. And I was like, there's no way that they're going to be able to pull this off. I'm not going to feel connected. And within like 2 hours of starting it, I was like, I love this. This is the best experience ever. It was wonderful. I felt like I learned an incredible amount. I felt super connected to my classmates. It was beautiful. Only Frontier. I feel I could have pulled that off.
I have to say something to y'all's responses. Faculty, we worked so hard to bring that together, to deliver it to the students. Your praise is the best thing I've heard in a long time. Thank you so much for that, because we worked tirelessly to make it a great experience for you.
Well, thank you for your commitment to make that a good experience for us.
Yes, thank you. It was wonderful. And just going back to the length of the program, is it 5 years? I feel like I finished my first master's in way shorter.
For completion, you have to have completed it within 5 years. The actual program of study is much shorter than that.
Yeah, that makes sense.
Okay, here's another question. Hi, I'm Amanda. I just submitted my application for psych mental health for spring. Other than looking for clinical sites, is there any other things you recommend I should work on while I'm waiting to hear back?
I definitely think it's a good place to start, to start looking for clinical sites and start networking. And I wouldn't say like, knock yourself out with, trying to learn more about psych, but if you're not working in psych, that might be something to look into. Just try to increase your knowledge base and your comfort level. And that for me, I worked in psych for several years, and I feel like that was a huge help. When I started my program. It's not necessary because I have a bunch of classmates who did not have any psych experience, who are doing very well. But for me personally, I felt like that helped a lot, to already be familiar with that specialty.
I would say just relax, enjoy the last few moments before you get really busy.
Okay, here's a question. Did anyone go through the program with young children? And were you able to take a full class load and balance life?
I will say, if you listen really carefully, you'll hear my two children running in the background. And I think throughout this class, most of my classmates have met my kids or heard me try to discipline my kids by being on Zoom. So is it doable? Yes, it is. Again, my wife is the goalkeeper downstairs. We've come up with very unique, I guess, hand signals that mean quiet, and sometimes that does not work. And I've found that taking the proctoral exams, it is best not to take them at home because you never know what you're going to get. They do not know how to read yet. And if they did know how to read, I'm not sure they would pay attention to that. So their inside voice is a lot louder than anything that we could possibly imagine. But yes, it's definitely doable. And also it makes it, they're a part of life. So that's what makes the experience great.
I'll
Okay.
just add, my kids are old, but two of my study buddies had really young kids, and they were able to swing it really well. I think it's a balance that you just, like Tim mentioned, like he has a partner, they talked about it, they worked it out. One of my friends though was a single mom and she juggled it. I think it depends on, and she felt pretty balanced to me. I mean, we all had some tears at some point, but I think that she was committed to the program and she knew it wasn't going to be easy. She knew she was going to have to balance kids, and she came into it with a very realistic view of what it would be like. And I think that that's a question you have to answer for yourself. Is this something that you want to take on with young kids? You know, Frontier's here, it'll wait for you. But if you're feeling like you're being called to this now, then yes, you can do it.
Okay. F&P companion DNP takes how long? I heard 7 years. Okay. You have to complete it within 7 years, but the program itself does not take that long. It depends on if you come through the program taking 2 years or 3 years. Tim, how long did it take you to come through the MSN portion?
So I started spring of 18. So I originally thought I would like be done this past summer. So in June, taking a 3-course sequence, I backed up to taking 2-course sequence, and so I will finish in December of 20.
So 2 years and a term.
Correct.
Yeah, that's it. The DNP portion is you can complete it in 4, 5, or 6 terms. So say about 3 to 3.5 years for both degrees. I heard someone say just a minute ago they finished both in 3 years. Did I hear that right? Or did I dream that?
Mine will be about 3 years, and that
Okay.
was full time.
Okay.
The WHMP,
Okay.
and then which is a little shorter than the FMP, I believe. So WHMP through DNP will be pretty much exactly 3 years.
Good. Any other experience, Michelle or Genevieve?
My timeline was pretty similar to Tim. I started in April 2018. I was planning on finishing in June of this year, but then with COVID, it delayed things a little bit. And so I actually finished in September. So that was about 2.5 years.
Good.
For master's. Okay.
Yeah, so 3 years and a little bit of change for my master's, and then my postmaster's psychiatric mental health certificate. 3 years and change, I think. So it really depends on, your track. It depends on if you want to go full-time or part-time. I don't think we actually have a part-time. If you want to go full-time or accelerated. And I chose the accelerated path for reasons. And I also wound up cutting back almost to nothing both times I was in clinical, and did 30 to 40 hours a week of clinical. So that made my clinical experience go by quickly. If you want to do less than that at like the 20-hour level, then your clinicals will be a little longer. Yeah.
Good, good. Thank you all. Lori, I hope that helped explain that, the program of study length and the completion time that you have. Okay, Heidi has asked a question. I'm a licensed direct entry MEAC midwife with a bachelor's degree in another area. I'm taking an ASN as I think with the RN I can apply to WHMP, FNP, or CNIP. Heidi, for entry, we are phasing out the ADN to MSN program, and for entry, you're going to need to have a 4-year degree in nursing. 4-year degree in nursing. If you need to talk to someone about the program, I can help you. My email address is lisa.chappell, CHAPPELL @frontier.edu. Email me and I'm glad to answer your questions.
Lisa,
And
can I jump in just to say also,
Sure.
Frontier is a small school, and the staff there are, there's not like hundreds of people that answer the phone when you call. I remember calling and being like, yeah, I just wanted to get some more information. And I have talked to that person like monthly, pretty much since I made that phone call. You will connect with somebody who works there, who is a staff member, who knows a lot, and who will talk to you again and again. They remember you, which is amazing given like how many students they deal with. It is so personal. It was almost like off-putting to me. I was like, what is this bizarre place where they're being nice and and following up with me and being supportive and actually answering my questions and getting back to me. It is unique. It is unique, I will say.
And Veronica, you also are asking to be able to talk to somebody. You are welcome to email me too, and I'm glad to answer you. And Genevieve brings up a good point. The admissions officers, the admission department knows the programs very well, and they can also help you. So any questions you have about your specific situation, they'll help you. Okay. Tiara, any other questions?
Yes, we have one more from earlier from Ryan. And Ryan asks, does anyone have experience or advice for someone on the wait list? Are there any stats with how many are actually accepted on the wait list?
No, if we have stats on the wait list, I've never heard them. I encourage you to just be patient because students are admitted from the wait list. So just be patient with that. Well, as we're closing out, do the members of the panel have any last words of advice for the audience?
Just hang in there. It's definitely a journey. Enjoy the ride. I can't believe that time has flown by so quick for me. And as I'm looking at the end of this first part of the journey, I am pleased with the things I've learned and the people I've come in contact with, and I'm looking forward to finishing up and getting out there and practicing.
I'll say the time will pass whether or not you're in school for it.
Good luck. Everyone should do it.
Yeah, it definitely does go by very quickly, a lot quicker than I thought. and that Frontier has just been a great place for me. I couldn't imagine have gone through all this in a different program with different professors, with different classmates. So I've just been very grateful for this experience and really would not have done it any other way.
One last thing, like I said, I'm calling in from Seattle, Washington. And what I love about Frontier is I've interacted with people from all across the country, the world, people that I never thought I would ever get to know, different accents. I love Southern accents. I don't ever hear them in Seattle. And it's just been such an eye-opening experience and such a cool, unique experience.
Thank you very much. Well, audience, thank you for attending our session. I hope that you found it helpful. To the panel, thank each one of you very much for your contributions. They were invaluable. And to my co-host, Dr. Delpech, thank you for your work and your participation. And I hope you all have a good week and happy Nurse Practitioner Week, everyone.
Bye, everyone, and thank you for a wonderful session.
Bye-bye.